guys, my name's Jen Slade and this is lesson 3 of Go Cup Yourself. So in the last few videos, I've been talking about developing a home cupping practice and some things that you might need to know before getting started with cupping yourself or with seeking cupping therapy from a licensed professional in studio. So the first video we talked just about introduction, a little bit about cupping, and in the next video, video number 2, we talked about contraindications and safety for cupping and spots to avoid. So before we get a little bit further along into how to actually do cupping and what cups I suggest you purchase and how to address certain issues, all the things are going to get into, which I know those are probably all the things that you actually want to hear, not me sitting here talking about all the science and details and other stuff. But I believe strongly in setting up a foundation from which to go forward, where you can be empowered with the most knowledge and information possible to make the right decisions for yourself and your body. So today, before we go any further, I want to talk a little bit about indications, which is a little bit more fun than contraindications, because in indications for cupping, we can talk about who would benefit a lot from cupping, who this therapy is for, and just touch a little bit on some of the conditions that cupping can be really, really beneficial for. So now I do have some notes over here. If you watched my last video, I gave you the same disclaimer, so if you see me looking over here, like, that's why. But so yeah, just talking a little bit about why cupping, why try cupping. And so there are some key themes that I see in my practice, some key things that I tend to treat repeatedly with cupping. And so just to start there, the number one thing, issue, concern that we address with cupping, at least in my practice with my clients, is just really tight tissue, tight restrictive tissue. Somebody comes in and it's like neck and shoulders are just like this, and it's painful and it's inflamed maybe, and it's maybe causing some limited range of motion. Tight tissue responds really, really well to cupping, because for a lot of reasons, but cupping can really help to lift up and create separation in all of those tight layers of tissue. It can help to bring fresh blood flow into areas that have not been receiving fresh blood flow. And remember, blood brings healing. So blood is what carries in nutrients, it carries oxygen into the cells, and it also carries out waste products and helps things that are not carried out in the blood clear up to the lymph, which also clears out toxins, for lack of a better word. Metabolic wastes would be a more proper term. Things in the tissue that are no longer serving us, and it helps clear those from the body. So really tight restrictive areas of tissue is number one, the most common application I see for cupping in my practice. So beyond that, kind of going hand in hand with that a little bit, muscle pain. Any kind of muscle achiness, soreness, cupping again can help to pull out any lactic acid, inflammatory byproducts from the tissue, while simultaneously creating release in the tissue on the cellular level. So that also, we work scar tissue a lot in my practice. I have quite a few women I am doing scar tissue work with for cesarean scarring right now, and I'm having some really beautiful results with some of those clients. So cesarean scarring, I do educate my clients who I work with cesarean scarring to work on themselves and to develop a home practice for cupping on themselves. So that's a video that I'd love to dive into with a little bit more information in the future. Also, any kind of scarring from sites of injury or orthopedic surgeries, even laparoscopic surgeries where it's just a little bitty scarring, all of these things can create like hiccups in the fascia. And so, you know, you might have this little bitty scar here, but you might have pain, you know, somewhere else in the fascial chain, somewhere else in the body that can be traced back to that restriction in that little spot. So cupping can really help to break up that scar tissue, and scar tissue responds really well to being broke up. And once we kind of catalyze that work, we catalyze the breakdown, enzymes can come into that injury site or that scar tissue site and continue to help break down the structure and the really dense tissue that's no longer necessary for like scar tissue, which was there to protect, but maybe is no longer needed to be so restrictive. So that's a really, really cool application for cupping as well that I absolutely love seeing in my practice. Scar tissue work is so rewarding and so beautiful. And going in from there, we can do facial cupping. And so there are kind of two main venues that I kind of look at, or benefits I look at with facial cupping. And we'll start with scarring. So like acne scarring, really big thing for a lot of people. I, for one, have some acne scarring that I do work on with cupping on my face. It's a very gentle cupping practice compared to other cupping practices. So generally with facial cupping, we do not leave any marks on the face at all. The only times that I would see any kind of marking potentially come up in the face due to facial cupping is if we're working TMJD issues. So anything like within the temporomandibular joint, we can do a lot of cupping to help release some of that restrictive tissue through here. The goal is never to leave marks on somebody's face, but sometimes in that work, marking can occur. So the other reason why we would do facial cupping is for lymphatic drainage. So, well, there's a few other reasons beyond that, but lymphatic drainage to help clear and drain the face. It's really beautiful for sinus congestion. Also, we can do cupping on the face just to help stimulate collagen production, to help clear out the pores, to help release some taut facial muscles. So there are really a lot of benefits to facial cupping. So at least one video coming on that down the road. So yeah, lymphatic drainage. We can also do lymphatic drainage with cups around injury sites, any kind of swelling. Cupping can help to just gently release lymph. So I'll do cupping definitely post-op, once it's cleared and safe, just to help any residual inflammation that may be, or congestion that's stuck in an area, to help release that from the tissue. So lymphatic work can be really, really beneficial. Also, limited range of motion. So I like, if you've seen some of my other videos with cupping, I like to do a lot of range of motion work with the cup. So maybe like you've got a restrictive rotator cuff muscle from some scar tissue or an old surgery or injury somewhere, and so we can cover maybe the whole rotator cuff or and accessory muscles in cups, and then take the arm through some range of motion, and those cups are going to help stabilize the joint, but also help release the muscle when it's held in certain positions. So that's really, really cool work as well. So those are the key indications for cupping that I see the most in my practice. That is certainly not an exhaustive list. There are so many applications, but those are the things that I kind of tend to treat the most within my practice, and the things that I tend to have the most experience treating in myself and my loved ones as well. So beyond that, I just want to talk a little bit about certain specific conditions. Let's just get in a little bit more detail of things that we'll definitely cover in the series down the road. Things that if you are suffering with and you would like to come see me for a session, that I'm more than happy and perfectly comfortable working with you on. So just a few of those conditions: headaches and migraines. We can definitely release a lot of this restrictive tissue through the base of the skull and the neck and the shoulders. Packs, a lot of this kind of tightness can contribute to migraines and headaches, chronically and acute. So cupping can be really beneficial as a practice to help prevent that. Also, going back to TMJD, any kind of temporomandibular joint dysfunction can respond really well to cupping. Any kind of face puffiness, allergies, congestion. That's a really beautiful practice, working on some lymphatic work to help release some of that. Neck, back, shoulder tension, said that already. Shoulder injuries, rotator cuff injuries, limited range of motion, pain, rehabbing from orthopedic surgeries, touched on that already. Also tendonitis, carpal tunnel syndrome, similarly plantar fasciitis. These are conditions, shin splints, these are all conditions that we can really help to release and improve the quality of with cupping. Constipation, there's a lot of really beautiful abdominal work that we can do with cups to help relieve constipation and get the bowels moving. I have some clients who absolutely swear by abdominal cupping for their constipation issues, so that's something really cool. And that, interestingly, I see tie in a lot with my cesarean clients. So that's a really cool connection that I've actually been able to see improvement on more than one condition through cupping. So that's a whole nother thing, which is so cool to get into. Low back pain, hip pain, IT band restriction, knee pain, quads, calves, hamstrings, anything, especially my fellow runners on here. As a runner, especially somebody who runs on the beach a lot, I cup my quads, I cup my hamstrings, I cup my calves all the time, just to help pull fresh blood flow in, to help flush any stagnant waste products out from the tissue. Helps so much with recovery. As an athlete, I can tell you cupping helps so much with improving my quality of performance long term. So that's a really cool thing that we can address. Knee pain. Knee pain is very, very often related to either a restriction above or below the knee joint, as so many different things attach in on that joint. So definitely with knee pain, there's a lot of different cupping applications that we can address, kind of depending on where your pain seems to be originating and where there are areas of restriction. So yeah, beyond that, ankle mobility, I said plantar fasciitis, that's kind of head to toe trying to go down the list. There are so many applications, diaphragmatic release, some hip flexor work. There are so many applications, and it just depends on your body and what you need. And you know, obviously it's hard for me to tell exactly how a session's ever going to go, because everything is connected in the body. So you might come in with an issue in your shoulder, and we might end up, you know, cupping to release the hip and the knee and the ankle, and everything is connected. And so as somebody who's also a student of structural integration, I'm very, very aware of fascial lines in the body, and following the patterns of pain referral, trigger point referral, anything through the body that needs to be addressed by cupping. So I hope you found that interesting. I hope that maybe I sparked some space for exploration here, maybe got you kind of excited about learning more about how to address a lot of these issues yourself, or even just interested in coming in for a session either with me if you're local to the Wilmington, North Carolina area, or with a therapist abroad. So thanks for tuning in, and keep your eyes peeled for more episodes about cupping and how to work on yourself coming up soon. Thanks so much. Have a beautiful day and take care.